The coronavirus is a newly discovered strain of a family of viruses that infect animals and sometimes humans. According to the U.S. Centers for Disease Control and Prevention, the virus itself, named SARS-CoV-2, originated in bats. In December 2019, the first cases in humans were detected, in the Chinese city of Wuhan. Early cases are believed to involve people who had been to a large animal and seafood market. The virus is now known to spread from human to human. How easily is not yet determined. Any given virus can spread reluctantly or be highly contagious. Measles, for example, is far more contagious than early analyses of this coronavirus indicate. One reason the disease appears to be spreading rapidly may be due to delays in confirming early cases in some countries, in part given that only recently has the ability to test for the virus gone beyond a few specialized labs, including in China and at the CDC. However, the rapid transmission of the virus on the cruise ship Diamond Princess, to at least 690 people and with 3 deaths, is one indicator that it spreads fast when people are in close quarters. Scientists don't know for sure the ways in which this coronavirus most easily spreads. But it is thought to be transmitted in respiratory droplets, the CDC says. That means close contact with others would be key to its spread. How can you protect yourself and others? Frequently and correctly wash your hands, scrubbing with soap and water for at least 20 seconds, especially after using the bathroom or before preparing food. If soap is not available, hand sanitizers may be better than nothing but are not preferred. Avoid touching your eyes, nose, and mouth with unwashed hands. Clean and disinfect frequently touched objects and surfaces. If you're sick, stay home. Cough and sneeze into a tissue or your elbow, not your hands or into the air. Masks are an important line of defense against disease transmission in hospitals, but there is little research on whether they work for the general public. The key, experts say, is wearing a mask that fits properly and wearing it consistently. Some infected people have reported little to no symptoms, the CDC says. In others, symptoms include fever, cough, and shortness of breath and can range from mild to severe, causing death. A CDC spokesperson tells Elemental it's too soon to pin down other symptoms. But a February 7 Chinese study of patients hospitalized for the disease, meaning they had severe cases, found body aches in about 1/3 of them and nausea and diarrhea in about 10%. Much remains to be learned about the progression of the illness, but the CDC thinks symptoms show up as quickly as 2 days after exposure or as late as 14 days. Recovery time is about 2 weeks for people with mild symptoms, and up to 6 weeks in severe cases, the WHO announced February 24. The coronavirus is coming to you. It's coming at an exponential speed, gradually, and then suddenly. It's a matter of days. Maybe a week or 2. When it does, your healthcare system will be overwhelmed. Your fellow citizens will be treated in the hallways. Exhausted healthcare workers will break down. Some will die. They will have to decide which patient gets the oxygen and which one dies. The only way to prevent this is social distancing today. Not tomorrow. As a politician, community leader or business leader, you have the power and the responsibility to prevent this.